People sometimes ask me, why do I need a skin cancer check every year? And if they're 20 years old and have not a mark on them, I will often say, well, perhaps you don't need a skin cancer check every year. Perhaps what you need is to be taught how to check your own skin as well as you can every 3 months. And we'll see you in 2 or 3 years if you are very low on your skin cancer risk profile. But if you're a 50-year-old, vaguely white Australian, yearly is optimal because it means that whatever you're growing, the second you leave my office, is only 11 and a half months old. Now, most melanomas are growing sideways at the start, so they're getting easier to find without necessarily getting more deadly. Deadly is when they grow roots. There exist skin cancers which grow straight up and straight down. They don't really have a sideways growth profile, but only about 15% of melanomas do that. They can actually grow to be deadly in as little as perhaps 3 months. Whereas the sideways growing ones, you kind of hope that yearly wouldn't let one of them get too out of control where I couldn't say to you, say it starts growing tomorrow, oh look, we found an early melanoma, hasn't got roots yet, 100% survival so long as we cut it out with appropriate margins. There is still that small percentage of melanomas that grow fast and somewhat unpredictably, where they grow straight up and straight in. So perhaps a better question might be, why aren't you checking everybody every 3 months? The answer to that is, well, it hasn't been proven to actually save enough lives to make it worth the huge expense that it would cost the Australian taxpayer and everyone's bank balance. And it wouldn't find a huge number of melanomas. So we encourage our patients to check their own skin precisely for the elevated, firm and growing nodule that's turned up only 6 months after you had your last skin check, because we want you to find your own deadly melanoma, please, because it didn't exist 6 months ago. Anything you leave longer than a year starts to be a bit risky. Now, some people are low risk and they're prepared to roll the dice. There are those people who've never had a skin cancer, who've lived indoors all their life, who've got what we call sort of type 3 or 4 skin, who've got no family history of melanoma and not a mark on them. Perhaps those are the patients who don't get checked every year, and it's appropriate to manage them that way. But if you're a Caucasian Australian who's hit age 50, it's appropriate that someone checks your skin out every year. It's a risk management strategy, and it's going to save someone's life, because 1 in 13 Australian men get a melanoma. And if you had a 1 in 13 chance of winning the lottery, you'd buy a ticket, because you'd be like, that could be me. But if you told 1 in 13 chance of getting a melanoma, you're like, oh, that won't be me. It's funny the way people think about skin cancer.